Welcome to this case-based veterinary section. In this series, we will explore real-life clinical cases and work through them step by step. Your goal is to think like a veterinarian, observe the clinical signs, analyze the finding, and make decisions based on the evidence provided. Each case will challenge you to reason critically and systematically, just as you would in a real veterinary practice. Let's get started and see if you can solve this case. Let's look at a classic case in equine medicines. A horse present with fever, enlarged lymph node and mucopurulent nasal discharge. Symptoms strongly suggestive of a respiratory infection. The veterinarian collects a sample for microbiological analysis. The ground staining reveals gram-positive cocaine chains that suggest streptococci. The lab test focused on sugar fermentation patterns, which are critical for differentiation group C streptococci, that streptococci mainly affecting the horses. The results are as follows. The trihallose negative, sorbitol negative, lactose negative, only maltose is positive. Analyzing these results, that is negative fermentation for trihallose, sorbitol and lactose, indicate the organism cannot metabolize these sugars. Positive maltose fermentation shows the organism can metabolize maltose. Based on this sugar profile, the most likely organism is Streptococcus equi, suspicious equi, the causative agent for strangles in horses. Now let's discuss why the other possible group C streptococci are less likely. First, take Streptococcus dysgalactia subspecies equisimilis. This organism ferments trihallose also along with maltose and lactose. It is variable. In our case, the trihallose is negative. If it is a Streptococcus dysgalactia subspecies equisimilis, then trihallose also should be positive and lactose will be variable. So it does not match. Next is Streptococcus equi subspecies zooepidemicus. Typically ferment sorbitol and lactose, and maltose can be variable. In this case, the sorbitol and the lactose are negative, so it is unlikely. The last one, Streptococcus pneumonia. This organism is primarily a respiratory pathogen in humans and occasionally in horses, but it does not ferment these sugars like the equine group C streptococci, and its clinical presentation is different. So this is also out. So our correct answer is Streptococcus equi subspecies equi. Therefore, the combination of clinical signs, that is mucopurulent nasal discharge, lymph node enlargement with the specific sugar fermentation pattern, that trihallose, sorbitol, lactose negative and maltose positive, point to the diagnosis of Streptococcus equi subspecies equi. This case highlights the importance of biochemical test in bacterial identification, allowing veterinarians to make an accurate diagnosis and implement appropriate treatment and control measures such as quarantine and vaccination strategies to prevent the spread of strangles in the herd. Thank you.